But let's get on with tonight's program. We thought it very important to try and draw some light and understanding onto this fast-moving story about the coronavirus which was detected in the Chinese city of Wuhan in December. The numbers in Wuhan are going up very fast now as the authorities are running through identifying who's got them. It's a fast-moving virus. It is obviously infectious, and we are seeing infections in the rest of the world, including in Thailand. The numbers in Thailand have now reached 25 confirmed cases, and I think people recognize it's inevitable this virus is going to spread around the world. What we don't know at this stage is just what kind of impact it's going to have. We were very pleased to welcome Dr. Daniel Kurtesh, the country director for the World Health Organization, who has a great deal of experience in dealing with pandemics. He was telling me about his experience of dealing with Ebola, which is clearly a very serious disease indeed. So he can bring great perspective on how the WHO deals with these things, and also an overall view about just how this virus fits into other viruses that we're all familiar with. Many people will remember the SARS epidemic of 2002-2003. We're also delighted to have Dr. Thanarak Plipat, who is the Deputy Director of the Bureau of Epidemiology at the Department of Disease Control in the Ministry of Public Health, and is probably the man really leading the thinking on how the Thai authorities have to tackle the virus, which is inevitably, given the numbers of Chinese visitors here, the virus is now present in Thailand. The numbers so far are not that high, but everybody expects they will rise. And to his right is Dr. Supapon Wachiraplusadi. Dr. Supapon has done some pioneering work in identifying viruses. She's also the Deputy Chief of the Thai Red Cross Emerging Infectious Diseases Health Science Centre. She was the Thai doctor who was tasked in this country with working on this virus when it was first identified. And in fact, she's done a lot of work in the past on coronaviruses which have been identified particularly in bats. So she can talk us through. Hers will be a fairly technical presentation. I've urged her to try and make it as accessible as possible for you, but she will explain a great deal about the technology of identifying viruses. Daniel, can I ask you first for an overview of where we're at with the Wuhan coronavirus?
Sure, thanks, Jonathan. Can everybody hear me way in the back? Thumbs up, great. Well, it's really a pleasure to be here tonight. My name is Daniel Kurtesh. I'm the World Health Organization representative here in Thailand. My office, I run a team of about 25 people. We have an office up in Nonthaburi with the Ministry of Health. And of course, we've been working very closely with Dr. Thanarak, his team, and others at the Ministry of Health on this issue. And I think just to say that, of course, WHO shares the concern of all people who are worried about their health and the health of their families. Identifying a new virus that causes infections like this coronavirus and watching this virus spread around the world obviously can be extremely unsettling. What's also true, I think, is and unsettling for me personally, is just the vast amount of information that's circulating. We're really all living this in real time. I think what I'd like to do is just begin by setting out what we know, okay? So what we know about this virus is that the epidemic center is in Hubei province, Wuhan city, but that the virus has spread across China and to 23 countries around the world. As of today, there's been over 20,000 cases reported globally, 153 cases, I think, outside of China. While we didn't really know this at the beginning, it's pretty clear now that the transmission of this virus is from person to person. And the people that are at most risk of infection from people who already are infected are those who are what we call close contacts. So family members, healthcare providers, people looking after people with the infection. So the closer the contact with an infected individual, the greater are the chances that another individual will pick up the infection. The virus appears to be stable, and while it has been found in asymptomatic people, that is, people who are otherwise well, it appears that those people are not the ones really driving the infection, and this makes, or the epidemic, and this makes intuitive sense because we know how this virus is spread, and coughing and sneezing is a great way to spread this virus. So if you don't have those symptoms, it's less effective. The symptoms are related to the respiratory tract, so lungs, throat, nose and throat. And the symptoms, from what we can gather so far, range from flu-like illness, mild flu-like illness, to severe pneumonia. And we know that, as I mentioned, that the virus is transmitted through in or on aerosolized droplets, such as when you cough or when you sneeze. So coughing and sneezing is obviously a very effective way to transmit this virus. But also, touching your nose and mouth, transferring those droplets to your hands, touching somebody else's hands, touching somebody else, touching a surface, can also transmit the virus. Severity. The experience so far shows that about 80% of people infected with the virus have a flu-like illness, a mild to moderate flu-like illness. About 20% of cases are severe, and so far the data are showing that about 2% of infected individuals succumb to the illness, die. I think there's two important caveats to that latest statistic, the 2%, and that is that it's very likely to be an overestimation because the case fatality rate is the number of deaths over the number of infected individuals. And at this point, we don't have a sense of exactly how many infected individuals there are. Because people with mild infections or mild moderate infections, a cold, a mild case of bronchitis, may never go to a doctor. They may never present to the healthcare system and therefore would not become part of that denominator. So we expect that the case fatality rate will probably decrease in the coming days as we learn more about this virus. And the second caveat about the severity is that those who develop severe disease and those who succumb, in many of those individuals have some other underlying illness, something that compromises their immune system, diabetes, lung disease, emphysema, asthma, that kind of thing. So this is something we see in almost every respiratory infection. We see it in the flu, we see it in the coronavirus. So there are still, those are the kind of things we know, and maybe I've missed some, and I'd be happy to answer your questions. There are still some things that are not truly fully figured out yet. And what we haven't fully figured out is what exactly is the spectrum of clinical findings. We know that it can cause severe disease. We know that it can cause pneumonia. We don't know, as I've said before, how many people sort of have mild infections, a common cold maybe, mild flu-like symptoms. And we don't know exactly how easily the virus is transmitted, if at all, in communities. Okay, so we know that it's transmitted between contacts of family members of cases, but we don't have a good sense yet of the dynamics of the transmission in the general population, as flu would circulate in the general population. We don't have a sense of whether coronavirus is doing that, and if not, how. One thing we do know for certain is the best way for people not to get this infection. And I'm going to sound like a broken record. This is something we've really been harping on. The most important recommendation that we can give people everywhere right now is the kind of basic advice that will prevent any communicable disease, the flu, the common cold. And that's about basic personal hygiene and respiratory etiquette. And I'm just going to go over the list because I got to do it. But I'm sure you've heard it all before, but it's really critical. And that's washing your hands on a regular basis. Wash your hands as often as you can. And if you don't have access to water and you do have access to alcohol or hand sanitizer, use that. Keep your hands away from your face and practice respiratory etiquette. And by that I mean when you cough or sneeze into your sleeve or sneeze into a tissue and throw away the tissue and then wash your hands. If you feel unwell, don't go to work. Don't come to the Foreign Correspondence Club. Don't go to any school or a crowded place. Okay, and don't travel. And if you feel unwell after traveling, see a healthcare provider and share your travel history with the healthcare provider. It's really important. Avoid people who are sneezing and coughing. Generally, respiratory illnesses don't get transmitted if you're more than a meter away from somebody, 3 feet to a meter away. So if possible, keep your distance. Cook all of your food well. And one thing, again, that I like to harp on is get the influenza vaccine. Influenza kills 650,000 people. Seasonal flu kills 650,000 people every year. So it's just a pitch for the flu vaccine. Get it. Right now, WHO is focusing on a number of things, but there's two things that are really the most important. And I think the priority that we're advising member states to focus on right now is limiting human-to-human transmission. That's identifying cases, isolating them as quickly as possible so they don't infect other people, and treating cases appropriately. And then vigorously following up their contacts. Identify who they've been in contact with, in close contact with, follow those people up, and do the same if they in turn develop infections. And the second thing is really about addressing the crucial unknowns that I've talked about. This is really all about the global sharing of information and data that will allow us to answer some of the questions that we really don't know or we haven't answered yet. So WHO and the world are learning new things every day about this virus. It's really critical to understand that what we say here tonight may not hold tomorrow. Things are changing. WHO is devoting its organizational resources, a huge amount of time and effort to learning about the novel coronavirus so that it can coordinate a better response. And we're working with member states and other partners to do this in real time. I think I'd like to finish. I know that I haven't addressed a lot of things, and I'm very happy to address them as part of your questions. I would like to end by congratulating Dr. Charnvirakul and his team. We work in the same building. We know how busy they have been, how hard they've been working to identify cases, trace contacts, and communicate risk. So, Dr. Charnvirakul, you're looking a bit tired, but I think that's very understandable, given how much you've been working. And also to Dr. Supaporn and her team, who were really responsible for rapidly identifying this virus in Thailand. If it hadn't been for the capacities of her lab and the studies that she's been doing on coronavirus, we would not very likely have been able to diagnose this so rapidly and identify and characterize the situation in Thailand so rapidly. So I think, Jonathan, maybe with that I'll end.
Thanks very much. Yeah. Dr. Charnvirakul, over to you. Particularly, talk to us a little bit about how you and the Thai government have been dealing with this virus since we first learnt about it, really in early January.
Thank you very much. As Daniel has already mentioned, that there are still a lot of unknown that's still existing today. When we start our journey, we don't know a lot about this virus, but we have to prepare ourselves. As any diseases that can turn to be epidemic diseases, in Thailand we divided our phase of operation into 3 different phases. Phase 1 is that we don't have any case in the countries. All of the case will be an imported cases. At this phase 1, it means that if you have epicenter in China, all of the cases are from China. This is phase 1. Phase 2 is when we start to have local transmission from the traveler or within the Thai population itself. Phase 3 will be the phase of acceleration, and we will have epidemic all over the countries. We have 3 phases of epidemic. In phase 1, the focus will be on the containment of the early detection of the cases from the travelers. So there are a few things that we have to do, and that is what we did. We set up the entrance screening at the airport. That is one thing. Second thing is we do surveillance in 2 settings. One is at the hospital, and inform all of the private and public, including the clinics, to identify all of the patients who travel from affected city who has certain symptoms like fever, upper respiratory tract infection, like cough, sneezing, sore throat, or difficulty of breathing. And then we will call this patient under investigation, and we are going to admit them and test them for coronavirus. This is what we did so far, and I think you know the number very well. Up until today, we have more than 450 patients under investigation. Today we announced 6 more cases, confirmed cases. So at the moment we have 25 cases of novel coronavirus. Are we still in phase 1? The answer is no. We start to have our local transmission about, I don't know when, but last week we were able to detect one of Thai who never traveled to China. So that is our first detected cases that has local transmission. The local transmission, if you ask me, when did it occur, I don't know. It may be that was the first case, or it may happen a few days, a few weeks before that. We don't know. But what we know now, we are in phase 2. That is, we start to have local transmission. Local transmission, in theory, is to happen to anybody who has come to the close contact of the imported cases or the Chinese tourists mainly. So we identify the occupation that may contact the Chinese tourists more than any other job. For example, tour guide, bus driver, taxi driver, or any occupation. Then we start doing surveillance in those populations. In phase 2, the focus will be on still early identification of the cases. But it may not be easy because we all know now that coronavirus can have a mild symptom. So anybody who may come to the close contact with Chinese tourists may come down with a cold, common cold. Not even flu-like symptom, don't have fever, just have cough, sneezing, runny nose. They may be missed by anything because they are not presenting themselves to the hospital or to any clinics. If that occurs, the situation of local transmission will persist for some time before we would able to detect the series of cases later. So at this moment, we can just estimate the number of how many cases we may have in the countries. But that estimate may not be very valid because we don't exactly understand or we don't exactly know the situation very well. As you all know that the Korean tourists returning from Thailand has already been diagnosed with novel coronavirus. It says several things. Maybe they come to the close contact with the Chinese tourists, or they may come to the close contact of the Thai population who may got infected. We don't exactly know. If we control this situation well, the phase 2 will be a little bit longer than it should be. But in most of the estimate, phase 2 will be very short, around 1 or 2 months before the epidemic start to take off. And now we start to see the situation just like China. The case increase every day. And if you look at Chinese data, you can see that the doubling time, or the time that the number of cases will be doubles, is around a week. So every week the number of patients in China will be double. This week, if they have 1,000 cases, next week it will be 2,000 or a little bit more, because actually the doubling time is a little bit shorter than a week. 1 week is very easy to memorize. So in Thailand, if we start to enter phase 3, you can expect that the number may increase probably at the same rate. But if we do good job, we may be able to slow it down a little bit. Now, will it enter phase 3? That's what we try our best. not to enter phase 3. We try to slow it down, and probably, hopefully, that we will be able to control it and stay on this situation for quite some time. At phase 2, then, as I mentioned, the focus will be on identifying the case, identify the contact, and tracing the contact, isolate them, and then if they got turned into a confirmed case, so that they don't spread anymore. So contact tracing, isolation of contact, of close contact will be the key activities, and now we are doing that very extensively. For every case we identify locally. If we enter phase 3, the more important things will be try to slow it down as much as we can. And another focus will be at the hospital, like what Chinese government is now doing. Because if there are too many cases enter the hospital, then there will be not enough room for all patients, like what city of Wuhan is now facing. So this is what we are doing and what we are planning to do, and hopefully we can control it. But if we cannot actually, if we enter phase 3, we can slow the number of cases as much as we can. Because as I mentioned earlier, if more cases enter the hospital, then there will be a chaos, and the case fatality rate will rise also. So
thank you very much, Dr. Charnvirakul. Dr. Supapong, perhaps you could tell us a little bit about identifying this virus, how it compares with other viruses that we know about, and how you go about testing the people who we think may or may not have the virus.
Okay, thank you, Jonathan. Thank you for inviting me to this important meeting. And today, allow me to bring you to my science world. As Jonathan said, that it's too technical, but I try to showing you that how Thailand can diagnose the first case in Thailand. Yeah. So this is the strategy, the laboratory testing strategy that we designed to diagnose the unknown, the task that Dr. Charnvirakul gave to me since, I think, the first week of January, that Dr. Supapong, could you detect the unknown? You say, how to detect the unknown. Yeah, so this is the strategy that we try to identify in our country. The first one is to identify the known, to differentiate the known from the unknown. We use the capability that we have in our country to identify first 33 pathogens, common pathogens that can cause the infection in the respiratory tract. First. So this is responsible by the laboratory at Bamrat Radun Infectious Disease Institute. So we are work collaboratively with the government and the university and the Thai Red Cross. And for the unknown, how to detect the unknown, how to identify the unknown, we use the different technique at the Department of Medical Science and my laboratory, the Thai Red Cross Emerging Infectious Disease Center. And because the task is the pneumonia, the respiratory infection. So I told Dr. Charnvirakul that I interesting into virus group that is influenza that cause flu that is common, that you know, and the other one is a coronavirus family, which is the common virus that can cause common cold and also the SARS and MERS. So I told him that I gonna focus first on influenza family and coronavirus family. But the strategy that I use to identify is not by individual, because this is the new one. If I use the method that I have to identify individual one, we could not identify the new one. This is a strategy that amplify. I should not use the technical term. To identify the virus in the whole family. and then decode their genome to know what of the species or what type of the virus. So, and then after we found it is, then we change the protocol to make it more rapidly, as like now. And this shows the timeline. We start, the Department of Disease Control start screening traveler from Wuhan since 3rd of January. And from that day, we got the specimen daily, every day from Department of Disease Control, and until 8th of January, the most memory days for me. We got a sample from one patient, the woman patient, and I used the technique that I told you, that amplify testing the coronavirus and influenza virus in the whole family, and then decoding. So on that day, we found one sample, one patient that positive for the coronavirus. At that time, we don't know yet that what is the disease, what is the pathogen that caused disease in China. But on that day, on 8th of January, I found the coronavirus DNA. And then on the next day, on 9th January, I decode that DNA and found that when in science, when we decode it, we have to compare with the genetic banks that in the that show that post in the NCBI is technical term again in the genetic bank, and then we found that the decoded sequence DNA that I found is similar to bad SARS-like coronavirus. At that time, there is no data on the novel coronavirus in the genetic bank. So at that time, I could not compare with the human novel corona that have right now, because at that time we waiting for China to release the data to the gene bank. So I sent the report to Dr. Chanrak that I found a bad coronavirus similar to bad coronavirus in that patient. It kind of like around 90% similar to the bad coronavirus at that time.
I just want to clarify something.
Yeah.
Dr. Silverborn. Were you searching for a new virus quite separate from what was happening in China, or was it the news from China that alerted you to look for this virus?
No, on that day, on the 9th January, because there is no data from China yet. We have just only this data.
So you had one case of a virus you couldn't identify.
Yeah,
so
I could not identify is it the human pathogen or not. I could not tell the Dr. Chanrak that this is the cause of the disease or not. But I found the DNA of virus from that patient that is similar to the bad SARS-like coronavirus. But 2 days later, on 11, when China released the genome of the coronavirus that caused the disease in Wuhan on 10 January, on the next day, 11 January, I matching my virus to China, and it found that 100% identity to the China, to the coronavirus in China. So I think today, 1 day later, the government announced that we found the same virus as in Wuhan. So this is the story. And in the same day, Department of Medical Science using the other method, different to me, and showing the same viruses, the same virus that compared to Wuhan. Yes. And this is the sponsor that I should thank, because the laboratory capability in my laboratory is not from just one day. We not buy any commercial reagents, but it came from 20 years research experience for the viral discovery, especially in the bat in the wildlife, because bat is the highest. We found a lot of new viruses in bat that not cause the disease in human yet.
And do the bats transfer it directly to humans or through another animal?
Bat to other animal, usually bat to other animal and to human, not directly to human yet.
Can I just clarify that your laboratory and the facilities that you have for both you and Dr. Charnvirakul in Thailand, you're also able to provide testing for other countries that don't have that facility?
Yes, of course.
Yeah. I'm wondering how many countries?
No, but actually, most of the time, if the specimen from other country if any country would like to send their specimen into Thailand, usually they will have to get a permission from several departments first. But if you ask if it's possible, it's possible, yes.
I was very struck by the fact that I hadn't realized Thailand had identified this virus on its own at the same time that China was working on it. It suggests that you've got quite a strong regional expertise that might be well ahead of other countries.
Yes, of course. They are very good. Yeah. This is something that I think you should all know, that this is the capacity. If you go back and look at the report from Johns Hopkins University on Global Health Security Index, you see that our laboratory score 100% out of 100 or 100. So they are really good.
So this is a good place to be when you've got a virus running around.
Yeah.
I'd like to throw the floor open to questions if anybody's got any. I'd like to prioritize working journalists if possible, but if there are any there, do go and line up. There's a microphone there if you want to speak. If you just kind of get yourselves in a queue there, I'll go through you one by one. Could you identify yourselves as well, please?
Oliver from Thailand Business News. I just have one question. Earlier this evening, there was a report that Thailand would ask for a medical certificate for Chinese tourists to come in Thailand. That was a report from Bloomberg, I think. Is this confirmed?
What is that?
Well, I have to say I saw that report too, but it was a very short one. There is a report on Bloomberg suggesting that Thailand will now demand that all Chinese visitors produce a medical certificate certifying they do not have the coronavirus. But I'm not aware of that from any other source.
It doesn't mean that they have to go and do the testing before they travel. It doesn't mean that. What it means that it means that in the first place we would like Chinese to do the exit screening, the standard exit screening, that is body temp measurement. If they have fevers, and that is by rules of the IHR already in international health regulation, anybody who has fevers usually should not be allowed on the plane. That's the rules.
Okay. So there's no certificate required.
Right.
Thanks. Michael. Yeah.
Thank you. Michael Mackey, freelance. Two questions, if I may. The first one is, before this virus started, we were all complaining about the air quality, and it's still there. And I'm just wondering if the high rates of air pollution are exacerbating the problems in terms of it makes it worse for people who have respiratory illnesses, as you mentioned, Dr. Curtis. So if you could take that question first.
We're all looking at each other here on the panel. I'm not sure. So
it's a world problem.
look, theoretically, I think obviously poor air quality it creates problems for anybody with underlying illness, and the combination of poor air quality plus infection with any infectious agent that infects the respiratory tract would create problems. So I think that's obviously that's a potential concern. I think the air quality is a large enough concern in and of itself.
And sorry, just as a quick supplement to that, we always, those of us that grew up in Europe, always believed that you didn't catch cold during the winter because the cold killed the germs. Is global warming also creating making it easier for viruses to mutate and spread? I appreciate you might not know, but if you could just give us some idea.
You know, I think what's happening, I mean, global warming, it's really about man's proximity to animals, I think, and species that normally we have not been in proximity with. As human beings move into proximity with animals, wild animals, domesticated animals, they're more susceptible for crossover infections. And I think we've really seen this. I think Ebola is a real classic example of this. And I think this coronavirus might also be, once we identify the source, might also be an example of this. But it's really about the changing activities of the human race, bringing them into closer contact with animal species that can transmit what we call zoonotic infections. So transmission of infections that originate in vertebrate animals and then end up in humans.
I kind of share the same ideas. Probably, I think both global warming and emerging infectious disease probably share the same root cause. Probably one of the main root cause is those deforestation that change the environment of how humans interact with wildlife animals.
So maybe I just can say, you know, our capacity to respond to epidemics, outbreaks, depends on a well-functioning health system. And certainly, global warming and the various sort of natural disasters that can occur, flooding, the things that we see associated with climate change and global warming, can affect health systems unless they're resilient. It can affect the structural integrity of hospitals, clinics, primary healthcare clinics. The migration of people can bring them together. It can have effects on the health workforce. So I think that there are both direct and indirect effects of global warming.
And then the other big question I had was that earlier on in this virus, a mainland official was reported as saying that they expect it to peak in the hot summer months. Is that likely to happen? Because my recollection of SARS was it petered out quite quickly.
So how long do we expect it to last? And when will it peak? What would the peak be? Or is that just pure guesswork?
In China?
Or here? Everywhere?
Oh, usually, if you look back at the influenza 2009, usually it should take about 6 to 9 months to peak. That's depending on how good our system would be.
So the worst is yet to come.
Well, and the dynamics of transmission,
Right.
which we don't fully understand yet. I mean, we don't fully understand whether this is going to behave like the flu or something else. And I think that's really part of the unknowns that we were talking about.
Next question, please. Yeah.
Hi, my name is Simon. I'm representing Bangkok Post. So my question is, do you think the measures that ASEAN countries have been taken on so far are sufficient enough and effective enough to prevent the spreading of the virus in the region? And is the situation really so serious that the imposing of travel ban on Chinese tourists is necessary? Thank you.
Well, we know what the WHO advice is, but perhaps you could give us a view on travel bans, and then maybe I could ask Dr. Tanarak to talk about, what the Thai government thinks is necessary.
So the issue of travel bans is really, it's an understandably difficult one. And it may seem intuitive and straightforward that, travel bans should work. But in fact, the global experience over many decades is they're not particularly effective. They're certainly not preventive. They're certainly not effective in preventing the spread of epidemics like the coronavirus. And that's really why the WHO doesn't recommend travel and trade restrictions. I mean, that's clear, and WHO is clear about that. Why don't we recommend them? Well, we don't recommend them because they tend to have a lot of knockoff effects. And I think one of the most important effects, based on my experience in Sierra Leone, when there was a significant restriction of travel to the West African countries, was that it was extremely difficult to get technical support, technical aid, medicines, et cetera, into the country. And this is often what we see when you have travel restrictions. One thing that travel restrictions and travel bans can do is discourage countries and communities from reporting illness. So it's a big disincentive to report if you're concerned that you might have a travel restriction imposed. And I think that they tend to be very costly, and they tend to divert resources away from interventions which we know are very effective, like things like public education and the public health response that we've talked about, that Dr. Tanarak talked about. That is efforts to identify cases, ensure that they have good treatment, and follow up their contacts. So I think that it's a difficult issue because it does make intuitive sense, but our experience is that they're not particularly effective. But we understand that countries, all countries will make decisions based on their perceptions and analysis of risk, and WHO will continue to collect evidence on the usefulness of these kind of travel restrictions, and make other member states aware and collect that evidence and share it.
Dr. Tanarak, do you believe that more restrictions on travel would help you in containing this virus?
If you asked me this question about 2 weeks earlier, it would be a very difficult question. But now I think the Chinese tourist has dropped by almost 80% already. So we have less and less Chinese tourists coming into the countries. One thing is that the reason I said that is that at the beginning of the epidemics, you have to understand that the only risk we have to have an outbreak or epidemic in the countries is that we have the Chinese tourists who come into the countries, and when they have diseases, they did not report themselves to any medical facilities. They continue to walk around the countries and spread the virus in the community. And that is something we cannot control. So that is the risk. And what we can do, that is set the screening, try to identify them as best as they can. That is to minimize the risk. Okay. So if we have more tourists, now is the weight between, this is the risk management, right? You have the risk and how you can manage, how can you manage or reduce the risk. So if you give the numbers of the Chinese tourists who come into the countries at the beginning of the year, that is January 1st, and if they continue to come in at that rate up until today, I think you know the number, right? Thailand is the number one tourist destination for Chinese tourists. Thailand have around 40 million tourists come into the country every year, and out of those 40 millions, 10 millions, 1/4 are from China. And at any given times, if you divided 10 million per years, at any given time there is more than 100,000, 200,000 Chinese in the country at any given times. So if, let's say, just throw out the numbers, if among these 100,000, if they have the disease at 1 per 10,000, at any given week you have 10 infected Chinese people walking around the country, right? That ready to spread to 2 or 3 uninfected persons. So that is quite a high number. Now, but that number has been gone, and now we are entering the phase 2. The effect of Chinese tourists at the moment, I don't think we are going to talk about it anymore because the number has reduced quite a lot. And now if you ask me about the number of, let's say, Chinese people who come from Wuhan itself, I think at the moment we have less than 1,000 in the countries, and it doesn't. I don't think it will affect any change in the epidemic pattern now.
Thank you very much.
Hi, my name is Sushada. I'm from the Bangkok Events and Activity Groups. I am a mother. I'm very concerned. I'm very, very concerned especially when I saw the gentleman in the middle's facial expression about the stage 3 that could happen on my. Could you please reassure me that the stage 3, like Wuhan, will not happen in a month? Can you say it with all certainties or no certainty at all? Or what is the government doing? Would the government be able to avoid such calamity? You have to understand, the citizens are concerned, very concerned. You can read the papers, and I am a mother. Have you found any cure, or have you found any prevention? Would the flu, influenza vaccine, would it help in any way? And I don't understand, how can you be good at stage 3? Have you been very good at stage 1 so far, may I ask? And has stage 1 been taken care of very properly? Have you identified and isolated, and have you followed everybody that come in contact with everyone? And one other question, I'm very concerned. Would you have to quarantine everyone that come in contact for 2 weeks? People will panic at this point, and I panic if one of my family were to contract something. That will I be quarantined for 2 weeks? Will you quarantine my pets as well? Please, I really have to know. Thank you so much.
I think, obviously, a lot of people are going to echo that kind of fear at the moment. I mean, you're not the only one who's a parent. I mean, lots of us are. And I think it is very good to get some context on how frightened people should be, because I think a lot of people are frightened. I guess any of you can probably a little bit.
Yeah, I can understand. I can understand and how everybody feel. What I just told that is what it may not happen at all, or if it happen, then we know that what our government is trying to prepare for. Of course, we prepare for the worst, and work ourselves at best so that it won't happen. Okay. One thing that I can assure you that our Thai system is one of the best in the world. This is one thing that I can assure you. If you go back and read the research paper from Johns Hopkins University, you see that Thailand ranked 6th in the world in what they call global health securities. That is how countries can, best prepare for global pandemic of any diseases. But in Johns Hopkins research, they also mentioned that there is no country prepared for global pandemic. No countries, even the number one, that is the US. If it's happened, it's happened. And nobody, at the times, no, you can mitigate it, but it would be very difficult for any country to control the disease that spreads so quickly. For example, if we have a new wave of influenza global pandemic, it will be very difficult for any country to stop it. Now, one more thing, as Daniel already mentioned, at the moment there is no vaccine for novel coronavirus, and at the moment there is no specific treatment that proved to be effective. There is no specific treatment. I'm correct, right? But there are several drugs or several regimens for treatment that has been tried, and probably may work in the situation. The US has tried one regimen, the Chinese tried the different ones, and there are several theoretical drugs that may be suitable for the situation. For any situation, one best thing anybody can do is not to panic. What happened today? If you are going out to buy the face mask at the moment, I don't think you can get it. This is because of panic. if we won't panic and we know what to do, everybody know what they have to do, and practice and behave themselves well enough. And as I always mention, if you saw me tell everybody on the television, there are 3 factors that is very important in controlling or slowing down the epidemic. If we can slow down the epidemic, we won't be like in Wuhan city. There are 3 factors. One is the germ itself, is the virus itself. As far as Daniel told you that it spreads so rapidly. The reproductive numbers, one infected person can spread to more than 2 persons, can infect it to more than 2 persons. That is how quickly it spread. And it has very short incubation period of about 5 days. That is why the doubling time is so short, less than a week. Okay, but we can all change this if we behave well enough. Now, the number 2 factor is how good our public health and our medical system are. And as I already mentioned, we are good, we are very good. But are we good enough? We'll see. Number 3, everybody in the countries is very important. Let's say, if everybody panic and if everybody act against the advice, nobody can do anything. For example, there is we all see this example. The patient in the ward, in the hospital, in patient ward, that they are not obey the physician recommendation. Instead of staying in their isolated rooms, if they walk around the hospital and cough all around the hospital and spread the disease all around the hospital, then there is when it's going to be bad. If you have cold, if you cough, if you sneeze, you cover it properly, or you wear a mask when you are going out in public, it reduces the spread. Instead of R0, that is the reproduction numbers, will be 2 or 3, it can be less than 1. So it is not just the government. It is not just the government. The government can do one thing, and it is just probably 1/3 of it. It's everybody in the country that has to help. And if you read the news from China, one of the things that they have, one of the main reasons at the moment that Wuhan city has hope, because they have collaboration from their population. They order their population to stay home, to stay isolated from everybody else, and everybody obey. And everybody, instead of point the finger at the government, everybody understand and cheer for the local government. That is how the disease can be stopped.
Daniel, yeah.
Not finger pointing.
You know, it's really hard to tell people not to panic. Ma'am, I hear the fear in your voice. I think all of us in this room are grandparents or parents. I have young children myself. I don't know if what I say will be of any consolation to you, but I'm cautiously optimistic, and I think I'm cautiously optimistic because I can honestly tell you that there is a massive global effort on now around the world to try and figure out more about this disease. There is more capacity in countries than there ever has been, and we've seen examples, perfect examples here in Thailand. Capacity that did not exist 10, 20 years ago now exists. We have partnerships and networks with doctors, civil society organizations all over the world to help us figure this out. There is an unprecedented sharing of information. You know, China identified this virus, sequenced the whole virus. That is, they identified the entire genetic material of the virus and shared it with the world. This is really unprecedented. So there are huge networks and partnerships that we didn't have that are now being brought to bear on this. We have social media that can communicate important messages, like the really basic messages about how people can protect themselves against this and other infections. Those are the basic things that I talked about at the beginning. you can go a long way to preventing infection with this virus or any virus by those 5 or 6 simple steps that I talked about. The flu vaccine. I mentioned the flu vaccine because, first of all, to put things in perspective and to remind people that seasonal influenza is still a big killer all around the world every single year. I mentioned the flu vaccine because it's prudent to get the flu vaccine, and the flu season in Thailand is coming up. It's prudent to get the flu vaccine so that if you get a respiratory illness, you don't have, and it's the flu, you don't have to go into the hospital and face a potentially overburdened health system. Flu vaccine could potentially, if people are vaccinated, could potentially lessen the burden on the healthcare system. Okay? So I fully understand your fear. Luckily, what we're seeing is that in most people, in most otherwise healthy people, this disease is moderate, mild to moderate, okay? So that the symptoms are not severe. They're more severe in the very, very high risk groups that I talked about. Again, I'm not sure if any of this reassures you. I understand fully your fear. We just need to keep working together with all the different countries, all the different partnerships we have to figure this thing out. If we have groups working on developing vaccines, and now we have mechanisms really for the unprecedented acceleration of vaccine development. I mean, it usually takes 10 to 15 years to develop a vaccine. With the procedures we have now for emergencies, we can develop vaccines within a year if we can figure it out and get them to market. And it's the same with drugs and therapeutics. A lot of minds are now working on thinking about how we're going to evaluate the kind of drugs that people are having experience with in the field, and then how we can test those more quickly than we normally do, and get them to market as quickly as possible if they're effective. So really, there's a lot of capacity in the world. A lot of people are working on this, and we all want to figure this out as quickly as possible.
Thanks very much, Elaine.
Elaine Kurtenbach, Associated Press. Focusing on those, the health systems and like the back end. I mean, I understand that the research capacity is great, genetic sequencing is great, but when you get down to the public health and the after effects of people who have the virus, and you see what they've done with building a hospital in Wuhan that has bed after bed after bed, all in one space. I'd like to kind of understand exactly what the capacity is of health systems in China, Thailand, and elsewhere to deal with large numbers of sick people who can infect other people. It's a strange thing to see in the 21st century, the same sort of layout of a hospital facility as what we saw during the Spanish flu over 100 years ago. So I was interested to ask about that, and also to what extent is antibiotic resistance contributing to the problems with the infections that people catch as a result of this illness? Thank you.
Yeah. You can answer the second question first.
Do you want me to answer?
Yes, please.
Antibiotic resistance?
Yes.
So, antibiotic resistance. So antibiotic resistance is basically that bacteria and other organisms that are normally susceptible to antibiotics are no longer susceptible to those antibiotics or require higher doses of those antibiotics to work. It's not a direct problem in this case because this is a virus, and viruses obviously don't respond to antibiotics. Viruses respond to different classes of antibiotics. Different classes of drugs called antivirals.
There is a problem. The pneumonia is ultimately a bacterial infection.
Pneumonia can be a viral infection.
Could I
viral
clarify,
pneumonia.
perhaps, so you save some time for us?
Sorry?
I've read some of the literature where they talked about the secondary infections, and
Correct.
I was referring to those,
Yes,
not to the virus being treated by
Totally,
antibiotics.
and I was just going to get to that. Where this would become relevant is in secondary infection. So people who have an already existing viral infection, a viral pneumonia, are susceptible then to getting the bacterial infections. And of course, yes, we still have antibiotics that are effective against most bacteria, but obviously we would potentially see more cases of bacterial pneumonia, and that might be, and then we might see, we would have to monitor the patterns of resistance among those bacteria to determine what the best therapies are, and monitor resistance in those germs.
I'm going to answer the
hospital design.
This is very difficult question to answer because there are still a lot of unknown, as I mentioned earlier. I'm not sure you read one research article about the prediction or the estimation of the number of patients in Wuhan or not. That study said that in January 25th, the day that they closed the city report the number of cases of around 500 cases, that is confirmed cases. But that study estimated that the total number of infected persons in Wuhan has already been at 75,000 infections. Or it means that among about the size of the city is about 11 million people, right? About 75,000 has already been infected. If that is true, then probably the epidemic of this Wuhan pneumonia or this novel coronavirus may not started in December, because we know that doubling time is about a week. In order for you to get to 75,000 infected people, the epidemic may started long before that, maybe. And then what the problem is that the epidemic started to roll and keep rolling until one day they start to detect it. And by the time that they were able to detect it, there are so many severe patients already that need care. Now, for any given situation, I still hope and believe that if we work hard enough with the system that we have, if we can slow down the epidemic, and you all know that our health system within country is, although we are developing country, but we have a very good care system of both public and private. If we can slow down the epidemic, I think the healthcare system will be able to handle the number of cases that we have. And I believe that we still have rooms. There are several other ministry other than Ministry of Public Health that also have healthcare facility as well, and they are willing to come in to help in this situation as well. You may heard that the Prime Minister has already given orders for the military part to also come in and help our public health sectors, and every sectors can join in and help. I think we can adapt if the worst case happen. I still hope that we are not facing that worst case. But if it's happened, I think we may suffer a little bit, but I think we can handle it.
Next question, please.
Yeah, Dominic Falls, Nikkei Asian Review. I came into Bangkok yesterday at Suvarnabhumi. Good news was the pilot managed to find the airport through the terrible air. When I came in, I saw the cameras in operation. I went past two. I went through immigration, and at immigration I was required to present my fingerprints. This is a new innovation that's been introduced in Bangkok. I had to put 4 fingers down, plus my thumbs. Everybody in the queue was made to do exactly the same thing. Now, it seems to me that it's not prudent to channel people in this way and risk spreading the disease when you know that it's coming through the airports if it hasn't already got to stage 2 and escaped. Why is it that the Immigration Bureau is continuing with this? Because I can tell you I was there for half an hour. It was not cleaned, the surface. So my fingers were on everybody who'd been through it. Can you explain this?
You put your immigration hat on.
I think this happened in every airport now, especially the US, right? Everybody go there and have to... 4 fingers. Yeah, right. Yeah.
Perhaps a bit of advice to your colleagues in immigration about sanitizing the
fingerprint. I think we have to tell to every immigration, not just Thailand, but all over the world. I agree. I mean, every country is now doing that.
Jonathan.
Hi, Jonathan Miller from Channel 4 News. Dr. Charnvirakul, for you as well, this one. Look, I'm no statistician, but I am fascinated in the number crunching. You said you know, the number of Chinese tourists is down, it's reckoned, by about 80%. And I know there are a lot of unknowns in this as you try to figure out the possible rate of spread. But the Thai Immigration Authority said last week, and I'm sourcing a well-known correspondent friend of mine from the BBC on this. We had a conversation earlier. Jonathan was talking about how last week there were known to be 2,700 people from Wuhan in Thailand. There have been 2 flights out apparently since then, so it's reduced a bit. You said there were about 1,000 known Wuhan residents in Thailand, so there's a bit of a difference there. But that 450 patients, you said, were under investigation, presumably not all from Wuhan. Without meaning to get too complicated in this, what I actually want to know is, while I realize that you're doing everything possible to try to slow the epidemic, you say that the Thai government is preparing for the worst. Without wanting to worsen the sense of panic that some may feel about this, I'd really be interested in asking you what could be the worst case scenario here. You know, when might Thailand enter phase 3?
There has been some discrepancy over the numbers. In fact, last week we were given 2 figures by immigration. One said there were 1,000 people from Wuhan. The other one said 2,700. I'm still not sure. I think the numbers are changing because people are presumably leaving.
Right. I can understand that. The number that I got is probably from the same source, that the number keep reducing every day because of the travelers that were able to go back to China from some sources. I mean, they may not fly back directly to Wuhan. That is why there are still some of the Wuhan travelers in the countries at the moment. But there is operation center in the Suvarnabhumi airport that trying to help the travel if they want to fly back to China, to any city. They will give assistance to the traveler to go back there. So the Wuhan number of travelers is reducing every day. That is one thing. And for the numbers, of about 20,000, that is the number that I got also when they start to open their operation centers a week ago, about 10 days ago. And the number has been reduced quite a lot in the recent days. Number 2 question, if I got it correctly, is that what I told you, you have to understand this. We have the meeting yesterday for preparation for an outbreak. As I mentioned earlier, I live here also, right? And I also have family, have wife, and have my son going to school as well. And the reason I work so hard during this day is because I don't like epidemics. I don't want it to happen here. It will change everything. That is why we work so hard for it. But if it happens, if there are given in given circumstances that we cannot control, and if there is something that went wrong, that we cannot control, and it happened. The numbers that I just gave you is just an estimate using influenza numbers, because there are a lot of unknown that we exactly don't know. We may have about 2 months, but this given a lot of things. Phase 3 may never happen. But if it goes so easily, like in 2009, influenza 2009 gave us only 2 months to prepare for the phase 3 of increasing the number of patients so rapidly. So what we are trying to do at the moment is trying to control the spread as much as we can. We try to identify every case, do every investigate and try to identify all contact tracing, all contact, and try to contact them and request them to stay isolated from other people for 14 days. If they have any symptoms, we request them to report to the health authority as soon as they can. And we also go to them to check for their temperatures and check for their health every day for 14 days. That is one best thing we can do. And at the moment, we have done that since day 1 of operation up until today. Today we have followed more than 1,000 contacts so far, and we not just give them a call. For most of them, we just go to see them for ourselves if they have any symptoms. If they have fevers, we are going to request them to move to the hospital right away. This is an old traditional public health ways of controlling any emerging diseases, and we do our best.
Next question, please.
Hello, my name is David Brown. I'm a freelance journalist, previously BBC staff. I'm concerned about the vast amount of information that's circulating about this coronavirus, and whether we're really getting to the heart of the matter in terms of how it affects individuals. Is the infection from the virus serious for individuals, or is it that it weakens a person who already has a sickness or an illness which they die from, because we don't get any information from the statistics about whether any otherwise healthy people are among the death numbers. In other words, has a previously healthy person who catches this virus died from it? Is it a killer virus? And to follow that up, are hospitals, therefore, the best place for confining people with this virus if it spreads within hospitals to sick people?
Yeah, I guess we've had a couple of fatalities who are quite young, although I think they might have had existing conditions. But you've mentioned before this, most cases, fatalities seem to be people with existing conditions. I suppose it's what everyone wants to know. How serious is the virus? Do we know, or are we still guessing about how lethal it is?
So I think I mentioned at the beginning, this is one of the unknowns. We still don't have a real full understanding of the clinical spectrum of the disease and what kind of illness is predisposed to severe illness and to death. So of course we have seen severe cases and deaths in otherwise healthy people. Whether or not this is different from infections like influenza, we also see influenza deaths in otherwise healthy young people, although not as frequently. So we have to figure out exactly how this acts. I think the virus does affect people who have underlying lung illness for obvious reasons. I mean, the system is weaker, underlying lung disease compromises respiratory system, and that not only predisposes to serious infection, but obviously if an infection occurs in a weakened lung or a weakened respiratory system, the person is likely to have a more adverse outcome. But again, from all that we're seeing, about 80% of the cases we've seen so far have been sort of mild to moderate cases, and the people have recovered. Again, we need to continue to share information. Countries that are experiencing infections, their people are experiencing infections with this virus outside of China, need to share their experiences to see if what we're seeing holds across other countries in the world.
Hospitals? Are hospitals the right place to send people? Maybe Dr. Charnvirakul can answer that.
Yes and no, but for this phase, I think it is probably one of the best one. Let's say if it is not hospital where we put them, we are going to let them stay at home. Stay at home who are going to expose or who is going to contact that diseases. It's going to be their family, their wife, their son, their husband, or their grandparents, who is a high-risk population as well. At the moment, we keep the patient in separate rooms. I mean, if we know that they got infected, we are place them in a single room with no other patient in, and request them to stay in the rooms until they are allowed to come out. So I think it will be at the different phase we may change that strategies, and in outbreak control we'll call the inpatient ward as a cohort ward. We are going to put the patient who has been diagnosed during quite the same times in the same ward. But we are not going to keep them, close enough so that the disease can spread from one bed to the other bed. And we are not going to put the patient with novel coronavirus with the patient who has not been diagnosed with novel coronavirus. So that is the ways that we can prevent the spread within the hospital. And I think that is the standard all over the world. Even in the influenza times that we are doing that. My comment is that the hospital, if we know what we do and if we do it correctly, I think I can assure you that it should be the place where we keep the patients.
Yeah, please.
So the real risk for hospitalized patients is to healthcare providers. Healthcare practitioners are a particular risk in situations like this because a nurse or a doctor or a physiotherapist might see 3 or 4 patients with this every day. They're in very close contact, so they're at particular risk. So it's extremely important that hospitals that receive patients adhere to very strict what we call infection prevention and control guidelines, a whole series of guidelines that the WHO has standardized and countries are using to protect healthcare workers against this infection. This is really perhaps the most important thing when we're talking about hospitalized individuals.
Philip.
Yes. Hello. It's Philip Sherwell of the Sunday Times here. Daniel, you praised China for their cooperation and their assistance and information sharing. There's actually a very different take on this, isn't there? Because we know that from mid-December, China and the Wuhan authorities, but this is China, so Beijing, knew that there were people in isolation wards in hospitals in Wuhan with this new virus. At the end of December, a Chinese doctor in Wuhan who raised this in an online web group was detained by police and forced to sign a document admitting self-criticism for rumor sharing. Last week, the Supreme Court in Beijing said it would have been pretty useful if people in Wuhan had heard those rumors and been able to follow the advice. Even by mid-January, when Wuhan finally claimed clean that there was this issue, or China did, they were still saying no human-to-human transmission. So Surely they were hiding things, they were covering up. In the wake of SARS, where WHO was sort of fooled by them driving people around in an ambulance to avoid you seeing them, why are you lavishing such praise on them? And Dr. Tanarak, how useful would it have been if you, in Thailand, had had this information shared with you from China a month earlier than you did? Thank you.
I don't get the second question.
The first question, I mean, is should we be praising China when clearly there were serious failures and cover-ups at the beginning of this, even though the sharing of information now is very, very thorough? And to you, Dr. Tanarak, would it have been helpful for Thailand and other Asian countries if China had shared its knowledge of this virus with you even earlier, because they didn't come clean initially?
Can I mention the first question for a little bit for Daniel?
Okay.
One thing that I think, as I mentioned earlier, now nobody knows when the epidemic occurred. Nobody knows. And telling you this, when I read the first time when I read the news, that is on January something, that they identified the cluster of pneumonias that share the same origin, that is the patient visiting the fresh market, one fresh market. You know what? That's one thing that come into my mind. That is, I asked my colleagues, my friends, and my staff, if that occurred in Thailand, of only 27 pneumonia cases, will we be able to identify that there is something wrong happen? So I think, to me, I am amazed that how big the city was and how quickly they were able to detect the outbreaks from that 27 cases. But as I mentioned earlier, at the moment, I think that's 27 that alarm the world may be, I don't know, maybe luck if we believe that there are so many patients already in the cities. The capacity of any countries to detect that kind of the needle in the haystack is very, you have to give credit to them. But I didn't answer the whole question. There are so many things that is still unknown, and I don't exactly understand why it is still unknown today. Because of, when I have a chance to hear the presentation from China, I can understand if this situation happened to any countries, and with the amount of, number of cases that happen, things that everybody want to know may be very difficult to find the answer anyways. But if you ask me if we have more information, will it be easier to work? Of course, yes. I wish to know so many things, but given the situation, we don't know quite a lot of things. But as one of my colleagues said, that our task, we have been tasked to go to Chiang Mai. But our vehicle is not ready, finished yet. We have to go there and fix and make our vehicle on the way as well. If it is not just the cars, probably it is the boat that we have to keep building on the boat, and while we are traveling to our destination. So that is the situation that nobody want, but given the situation, we have to do it. So if for your question, of course I wish to know more, and if there is more knowledge about this, the better prepared we will be.
Daniel, are we being fair or unfair?
Are we being fair? I think fair, unfair. I think really what I was talking about was the specific issue of sharing the virus. The capacity of China to diagnose and their sharing of and publication of the viral isolates. I know there's a lot of this kind of news coming out of China, and I think it'll be some time before we understand fully what happened and what's going on. I think the reality now for WHO is to focus on the current situation. We have to continue to work with China. It's obviously extremely critical to understand what's going on. I think we need to continue to work during this epidemic and beyond on improving countries' capacity to detect, diagnose, and yes, report these kind of outbreaks, and to continue to push countries to be transparent and to share fully information about these kind of events as is mandated by the international health regulations.
Frank, and I'm going to take one more question after that, and then I think we'll probably call it a day.
Frank Fu from Guangming Daily, China. First of all, thanks for the medical team from Thailand. Especially those days as a Chinese, I can feel the kind of a big appreciation thanks to the Thailand people and especially the Thailand medical teams. And those days, there are lots of susu on the websites, and we all have seen that it has been widespread in China, and the Chinese people are really very grateful for, especially like the medical team. I think among the 25 infected, most are Chinese. So I think the Chinese people owe you a big thanks. Thank you. And here comes to my question. The first one, Doctor, you mentioned about the phase 1, phase 2, and the phase 3. So could you elaborate a little bit more about the phase 2, like the duration? How long do you expect the duration for the phase 2, and what are additional measures being taken compared to phase 1?
You want to know the different measures in phase 2 compared to phase 1?
Yeah, what's the additional measures being taken?
I think you've kind of talked about that, but perhaps you could just remind Frank of the different things that you've done in phase 1 and phase 2.
Right. Like, for example, in phase 1, you are focusing on travelers, doing screening at the airport, screening at the hospital, and also at the community level for the import cases. Phase 2, you are focusing on doing investigation, identify contact, and do contact tracing, doing it meticulously. And we hope that we can identify every contact, and if we can isolate them, and if they come down with the disease later, they are not going to spread the disease to anybody else, right? Phase 3, it has to be focused on giving care to the patient and slow the epidemic down. Now, when I say that we have 3 phases, it doesn't mean that we have to go through all 3 phases. I still hope that although we are entering phase 2, we can keep the situation to be like this or reverse it to phase 1 once again. That is why we work day in, day out and get less and less sleep every day, because we hope that we can do it. It doesn't mean that it's going to 1, 2, 3. It can be going 1, 2, and go back to 1. That is what we hope for. But we have to know that there is a chance also that we may entering the phase 3. Okay, and if it's entering the phase 3, it doesn't mean that we have to be like Wuhan. I think if we work together, we have a very strong health system already. If we can collaborate and be just like very enthusiastic, just like Wuhan people at the moment, that they try to help themselves and be understanding to the situation and try to get out of this mess, and then I think we are going to be okay. Okay.
And the second question, at least can we still see, because I read one kind of a saying, maybe from the official website, from the government website, it said that the coronavirus could be prevented, could be controlled, and could be cured. Can we still say something like that?
I think this is just, there's been news coverage about Thailand's success with antivirals, but my understanding is that Thailand's probably using much the same combination of antivirals as the Chinese doctors. I mean, is there any special Thai treatment anyone knows about?
It's the same. It's the same antiretrovirals that the Chinese use. It is antivirals that has been used in HIV patients, and as far as I know, they have been tested in SARS patients. SARS is the coronavirus as well, and as far as I know, it can reduce the severe disease among the patient. It can reduce the possibility of getting the severe disease. That is why the Chinese is using this regimen as well. But so far there has not been a proof of effectiveness. And as far as I understand, I believe that there are a clinical trial or the study that there are, if it is not clinical trial, there is a study trying to prove that the regimen work or not. So we will know very soon. Secondly, there are several hypothetical drugs that may be able to use to treat these patients. If you read the news, I believe that the U.S. use one drugs is the new nucleoside analogs that they use to treat their patient, and they claim also that the drugs work very well on the patients. We will see, but that drugs that the U.S. use is now still an investigational drugs, if I understand correctly, right?
This is the drug produced by Gilead, is it?
Right.
Yeah.
Right. It has not been registered yet, and there are several other antivirals that has been believed that it may be able to use in the patient as well. So today is so far different from, as Daniel mentioned. I think although there are a lot of unknown, but we still have a lot of hope as well. There may be drugs out there that may be able to treat this illness, and I hope that very soon we will know and we find out what medicine that can use to treat this. But as Daniel mentioned, and I also mentioned earlier, is that so far there has been no antivirals that has been proved effectiveness on these diseases. But I don't think this will stand long. Probably today, tomorrow, it may change. I don't know. But let's keep finger crossed, I hope.
Okay, thank you.
Next question, please. And I'll take one more after that. Sam, with the last one, okay.
My name is Jeremy Colson. I'm an overseas member. It's encouraging to hear Dr. Turnsak mention Johns Hopkins and Johns Hopkins' ranking of Thailand as having health services which are, I think, the sixth best ranked sixth best in the world. But I wonder if, in fact, a report that appeared in the Bangkok Post in the early hours of this morning, based on another university, this was the University of Southampton in the UK, is getting enough attention here. Apparently Bangkok, according to the report by Southampton University, Bangkok and Hong Kong are the two cities the most vulnerable for the spread of this virus, the most vulnerable on the planet. And they go on a little bit further to say that according to movements by air by Chinese, Thailand is actually more vulnerable than any other country on the planet, alongside Japan. I wonder if really that has been taken on board, and what you think of that university report in the Bangkok Post in the early hours of this morning. Thank you.
I suppose this invariably goes back to you, Dr. Tanarat. I mean, I've seen the same report. There's the report that Thailand is one of the most prepared countries, but also it's one of the most vulnerable because of the simply because the numbers of Chinese people who visit here.
Yeah.
I think a lot of people have been watching Thailand and wondering. You seem to be very much on top of it, but I think for some people there doesn't seem to be quite the same sense of urgency or concern here that you see, for example, in Hong Kong.
I saw this. I saw that report as well, and I think they give us the highest risk among all the countries. Yes, but you have to understand this, as I mentioned earlier. So, let's put it this way: we have to go out and sell, and our boat is not finished yet, and we still have to go. And on the way, we have to keep on building our boat. You have to remember that at the beginning, someone already mentioned, the Chinese said that this disease is not transmit from human to human, right? But so we did prepare for. I mean, if you ask me, do I will that be true, or should we prepare for human to human transmission as well? I think we already did prepare for human to human transmission, but there are still a lot of unknown. If you go back and look at MERS and SARS, you see that it was not that easily to transmit from person to person. If you look at the numbers, SARS outbreak lasts about 1 year, 1+ years, and totally globally, there were only 8,000 cases in that 1+ years. And if you look at MERS, their sibling, MERS starting in 2012, up until today, there are still sporadic cases occur, and there are roughly about a little bit more than 2,500 cases. So at the beginning, we expect that probably there may be some human-to-human transmission because of its behaviors. That can occur, but one thing we don't know, that is how easily it spread. What we do is that we follow the same the standard that we do every time when there is emerging infectious diseases. We set up the surveillance at 3 sites: at the airport, at the community, and also at the hospital. Although we may not do it, so loudly also, so loudly as Singapore or Hong Kong did, but I believe that we did our best to set it up so rapidly. We activate our emergency operation on January 3rd, and it's up and running from that day. I always joke with my friend that it's just 2 days after the New Year celebration, and Thailand this year they promote the praying during the New Year's Day, right, on the December 30th and January 1st. I told my friends that right after my prayer finish, my job start from that day. I think our teams doesn't rest well on any days. We work 7 days a week and more than 12 hours a day, every day from then. But I don't think you heard that because we keep it quiet.
Last question, Sam.
Thank you. Sam Wright, club member. I would like to address the issue of the contradictory statements about the effectiveness of face masks.
You're clearly a believer.
Well, to make a point. A lady sat at our table earlier and mocked my mask, saying, "Oh, well, don't you know that these are so small of a particle that they pass right through?" And the Bangkok Post posted a long article, letter, arguing the same thing. But in your presentations, there was mention that, well, these, you think one of the major reasons of spread is through water particles that either come from coughing or sneezing that land on surfaces or directly go into contact with us. Would not these masks then prevent the spread down to a counter if you're wearing it, or having the water particle penetrate, carrying into your lungs as well? And if it is effective this way and something that we can use as a critical means of first defense, why did the representative of the World Health Organization ride in the cramped elevator with me and my wife and not wear a mask?
Okay, let's let the panel answer that, because that's your question's on the minds of many people. Masks. Daniel, you can start with them.
Sure. There are WHO has published very detailed guidelines about masks, and they're available on our website, and I'd be happy to share that link with you. But basically, masks can be effective. They can be useful, and in fact, there are really two caveats to that, though. Masks should never be used in isolation. If you're going to wear a mask, yes, but you also must use the other basic respiratory and hygiene things that I talked about. Okay, masks in isolation it's very important to use the other methods that I talked about. The second caveat is that actually masks if they're going to be effective, they have to be used properly. There has to be a proper seal around between the mask and the face. They have to, if you're disposing, they shouldn't be reused. Once they're damp and moist, they should be discarded. Single-use masks should not be reused. And if you're discarding a mask, you need to do it in a proper way. Never grab the mask by the mask. Take it off from behind, discard it, and wash your hands. So again, if our guidelines are pretty, WHO's guidelines on masks are fairly clear. WHO does not recommend masks for people who are otherwise healthy and who have no symptoms. We do recommend masks. The mask can be effective given all the caveats that I mentioned in people who have respiratory symptoms or people who are looking after people who have respiratory symptoms.
Could I just say something real fast, please? I think I have a big concern that represents all the Thai people in this country. I believe that the government has thought about the economy above the safety of the citizens, because it's impossible to identify and isolate so many people. Tourists, it's not possible because this disease doesn't have symptoms. So I believe that the stage 1 doesn't work and it cannot prevent stage 3. Thank you very much.
Thank you, and with that I'm going to end the program, and please give a big warm round of applause to our panel who've stuck through the questions very well.